Thank you, Mr. Chairman. Secretary Azar, I want to tell you about a couple of constituents. Mary from Franklin, Wisconsin, attended a roundtable I had over the president's recess week on the price of medications. And she worked for Kenosha County for over 20 years, retiring as a child support caseworker. She has diabetes, and the cost of her medications, including insulin, are over $1,500 a month. She said to me, I'm just one of millions of people that have this problem. There are people who are not getting their medication, who are dying because they can't get their medication, who are deciding on food or medication or paying mortgages. At that same roundtable, I met a father whose young son had a severe allergic reaction. He was treated at the hospital, and then the physician prescribed epinephrine. Because of the child's tender age and weight, an EpiPen was not appropriate because it would contain too high of a dose. And when he went to fill the alternate prescription that had the right dose, the out-of-pocket cost would have been $5,000. Now, I was in disbelief when I heard that. He explained a little bit more, and what he ended up doing was buying an EpiPen and praying that his son will gain at least 7 pounds before he next has any type of allergic reaction. But how frightening. So in December, the House of Representatives passed a comprehensive prescription drug pricing bill that included my bipartisan Fair Drug Pricing Act. The Fair Drug Pricing Act, as you recall, passed out of the Senate Health, Education, Labor, and Pensions Committee last June. You noted in your testimony that the budget supports bipartisan drug pricing proposals. However, it does not support explicitly either the House-passed bill or my bipartisan Fair Drug Pricing Act. We've talked a lot about transparency in this industry. Do you think pricing transparency would make it harder or easier for Congress to oversee the drug corporations and enact sensible policy that would bring down prices?
We do support notions of drug price transparency. In fact, I tried to get, and you all supported me, thanks in particular to Senator Durbin's great work, tried to get specific authorization to explicitly require that drug companies disclose their pricing in their direct-to-consumer advertising, and we're now having to, rather astonishingly, litigate that issue in courts because the drug companies are embarrassingly ashamed to talk about their prices.
Right. So the Fair Drug Pricing Act would say if you want to raise the price, you issue a report to your agency with justification and full transparency. We talked probably around a year ago about whether we are even capable of showing a follow-the-dollar chart. When you, say, have a drug that's priced right now, list price is set by the drug corporation at $100, what piece does the manufacturer take? What piece does the PBM take? What piece does everyone along the way take of that? And then when they double it, how does that change? Where does the extra $100 go? We don't even know that. And so I urge you to work with us to pass the Bipartisan Fair Drug Pricing Act. I think it will so help our ability to rein in these prices. In my few seconds left, I want to switch gears and talk about the vast expansion of junk plans that has occurred under this administration. There was a study released just shortly ago that found these junk plans impose extraordinary costs on very vulnerable populations, those newly diagnosed with cancer. According to this study, a patient that's newly diagnosed with lymphoma and covered by one of these junk plans could pay anywhere from $23,000 to $45,000 in out-of-pocket expenses in the first 6 months following their diagnosis. The other issue that I wanted to point out is we're talking about coronavirus. We just had reporting out of Florida that somebody who had recently traveled to China presented for concerns that he might have contracted the coronavirus may be charged thousands of dollars in out-of-pocket costs for seeking care because he's covered by a junk plan. How does the expansion of junk plans by this administration help us during severe outbreaks like the one we're currently experiencing and is very frightening as we move forward? And how does it help somebody who incurs cancer, who is diagnosed with cancer?
So short-term limited duration plans are not right for anyone. We've been very transparent about that, and they existed under the Obama administration at the
They
end
were
of
3 months, now they're 3 years.
Actually, no, in a
You're right,
midnight, in
at
a
the
midnight
beginning.
regulation, they shortened them to 3 months, and we restored that.
Because
They're
of
not
the
right for
impact
everyone.
on the rest of the market.
Well, they're not right for everybody, and we've enhanced actually the consumer protection notices even from what the Obama administration had. But some insurance for some people might be better than not being able to afford any insurance. These are 60% off and cheaper than Affordable Care Act plans for people who aren't subsidized. So it's an option, but it's not the right option for everybody, and we've tried to be very transparent about that.